I've got a question for you. So the question is, what treatments are there for albinism? So we've kind of touched upon it before in terms of like you can have head posture surgery for if you have a null zone for nystagmus. What other things are there, or is there anything that can help people who have albinism?
Yeah, it's a good question, isn't it? Essentially, one way to think about it is for people with albinism, there are certain problems with vision, and you may think about treatment specifically for those individual problems. So, for example, as you said, nystagmus is often a part of the visual problem in albinism. The sorts of treatments we have for nystagmus tend to be supportive, meaning we're not doing anything to really change the state of the nystagmus, or we're trying to do something to make the nystagmus better itself. And in terms of trying to make it better itself, the mainstay of treatment, to be honest, is that often people have a null zone, so they hold their heads in one position to get their best vision, and we can do surgery on the muscles of the eyes to try and move that position more central. For some people, that can also widen the null zone, so it not only moves it, it makes it bigger, so they've got a broader area where the nystagmus is least. And for some people, it can actually increase their visual acuity a bit on the chart at the end of the room. But mainly, certainly in the UK, we do it for head posture with those other potential side benefits. The other sorts of surgeries we have is less about head positions for null zones. It's about people who, when they look at something closer to them, the nystagmus reduces a lot, and that's called convergence dampening. Sometimes in that scenario, we can give prism glasses, or we can actually operate on the muscles of the eyes to again trick the brain into thinking it's looking near without needing to do so. But again, that's all about trying to give the best nystagmus for the broadest range of eye movements. So from the nystagmus, there's also medicines that we can sometimes use, and this is very case specific. So there are a number of drugs, all of which essentially dampen your internal state. So your kind of state of anxiety is one way of thinking of it. Because we know people with nystagmus, if you're super stressed, you're literally walking into your A-level examinations, whatever, your nystagmus is going to be least good in that moment, probably, because the stress makes the nystagmus worse. So there's a whole load of medications that can be used, and broadly they all work in a fairly blunderbuss way to try and dampen that anxiety. The problem with most of them is they have a side effect profile, and so it's a balance between benefit and risk. So again, it's patient specific, because if you're someone who in their mid-30s suddenly got nystagmus for whatever reason, and your world is moving constantly, your appetite for side effects is going to be far greater if you can actually do something about that horrible symptom than somebody who's had nystagmus all their life and they say, well, you know, this medication has maybe made a bit difference, but it's made me feel tired, etc., etc., etc. So the medications are not perfect, and for people with albinism, we more often don't use them than we do, if you like. We also don't use them in children a huge amount. Very occasionally we use them in older children, but essentially the medicines are not super helpful in people with albinism for the nystagmus. So that's all in the category of what we can do for the nystagmus. In terms of other treatments, and this is super important, what we need to do is support patients to have their best vision for the most of the time, and that's particularly important for kids under 8 because their brain is still learning to see. So what I mean by that is if a child could ideally have some glasses to make their vision a bit better when they're 2, 3, 4. Sometimes if you're not a person with albinism, we'll say, oh, it's okay, we can sit on that for a bit, let's leave it. For people with albinism or any other visual condition, we want to maximize, get them absolutely every little millimeter of better vision they can for as long of the time as possible, because the brain is learning to see till you're about 7.5 and 8. After that period, we can't really make those things better. So supportive therapies with glasses is the most important. Looking for squints, so that's the eyes looking in different directions, and that's important particularly because often the brain will start to ignore one eye and we need to patch, so that's called amblyopia. And then potentially things like contact lenses can be useful as well, and there's a whole load of reasons why contact lenses can be useful as a supportive therapy, sometimes even with tint in them. Sometimes there's some feedback such that it can reduce the movement a little bit, but these we would consider all these supportive therapies. So that's the support, the nystagmus stuff, and then the supportive therapies for absolute overall vision. And then the third category is for people with albinism, are there treatments? And at the moment, we don't have a treatment to try and correct the problem in the retina, the nystagmus, the unusual crossing at the chiasm of the optic nerves that we always talk about. But there's quite a lot of work going on in that space across the world, and we have a number of studies ourselves in the UK looking at potentially medications that you could give very young children with albinism to try and either get their bodies to start producing pigment or produce the things that pigment produces in your retina to make it form better or more typically. And so these drugs are going into clinical trials now. Some are very early stage, some are a bit later stage. And we talked a bit before about the L-DOPA drugs, which is probably the one that's furthest through. So there are absolutely things on the horizon for actual treatments for albinism, but they are quite early stage. So I think in answer to the question, it's a very long answer, but in answer to your question about treatments for people with albinism, think of it as three categories. Supportive things that are super important, by the way. Then there's things that we can actually intervene on. That tends to be around the nystagmus. And then finally, there's things on the horizon to actually try and deal with the underlying problem and get the retina to build itself in a more typical way to try and rescue some of that vision. And those they were an exciting time that those things are kind of coming through now.
Do you think that for me and adults in my lifetime there'll be anything, or is it not quite there yet?
That's a good question. So there's two parts to the answer to that one. The first thing is to say that the way we understand that the brain works is that your brain needs to learn good vision by the age of 8. Otherwise, it will never relearn that good vision. Now, there is some sort of soft edges to that, in that it's called neuroplasticity, and there's even work being done on drug treatments which might open up that again. So get your brain to say, look, I'm still 6, I can still learn new things. So there's a whole field of work going on in that. But currently, broadly, our understanding is that the brain has decided what vision is by that age. And we know that because children who have, for example, let's say a droopy eyelid, so an eye that's shut, if you leave that shut until they're 8, you'll never get that eye to be a good eye. You might get something out of it later on, but not much. And that's purely because they've never had stimulus in it. So in answer to your question, as an adult with albinism, we're always going to have that problem, to be completely honest. But the counter to that is that some treatments may be targeted at the nystagmus itself. And so if your vision is actually quite good at times when your nystagmus is least bad, then there's potential, if we could do something about the nystagmus, to get you your best current vision all of the time. And the other thing that you've talked about a lot is your photophobia, and that could be another whole set of treatments. So even if we gave you a drug or did a surgical treatment, whatever, to try and get a bit more pigment in your iris or something else to help work in the way that a iris would, we're not really changing how your retina functions, but by controlling the light, that can have a huge impact for you. So I think there's still hope for adults beyond the age of 8, but it's quite nuanced in terms of what those things are likely to be in reality. What do you think?
So you're saying that you're hoping for younger babies and tiny tots, you'll be able to improve their acuity. But for me and people older than the age of 8, that won't happen. But some of the, I guess, like symptoms of albinism might be able to be treated.
Yeah, I think that's a reasonable summary. I think that that won't happen is a bit strong, just because there is the chance that some of these neuroplasticity sort of research areas come on and we say, well, actually, we can get the brain to start learning better vision. So that is a possibility. But the other thing, as you said, even if we're not improving the retina's ability to see, as you well know, in your best scenario, the best lighting conditions, you're in the best mood of your life, your head is in the perfect position for you, that vision is quite different to you at your worst. So if we can have things that can get you at your best, that's still a big impact, I would say. And those are the sorts of things which I think will come through for adults soonest, I think.